everybody has a copy of the agenda in front of them. The first item on the agenda is the approval of the previous meeting minutes.
So moved.
Okay, we have a motion to approve of the
Second.
minutes, seconded by Mr. Feeney. All in favor?
Aye.
All right, if it's all right with the members of the committee, I'd like to take the current business up first, since Ms. Ziegler's here from the administration, and then we'll move through some of the other items. So if we could, without objection, I'd like to take up item number 22. All right, great, thanks, everybody.
19.
Wait,
What about 19?
Oh, and
Take that 19.
19.
19.
Mr. Ethier is here. My understanding, Mr. Ethier, is you're going to withdraw current business, item number 19, resolution number 496.
Yes, at this time, Mr. Chairman, I'll withdraw for do a little more research, and for a better harmonious relationship, I'll withdraw at this time.
Okay, so we're gonna request the sponsor. Item number 19 is withdrawn from the agenda, and now we'll move on to item number 22, authorizing an agreement with Planned Parenthood of Hudson and the YWCA regarding prevention education.
Thank you so much, Mr. Chairman and members of the whole committee. This is a renewal grant. We are finishing up our 5-year grant with the Department of Health for prevention education that we've done, and this is a renewal, a 3-year renewal, to continue to work. We partner with both Planned Parenthood of Mohawk Hudson and the Y of Mohawk Valley, and if any of there was questions of how that came to be about, when the original grant came out, CDC used the New York State Division of Criminal Justice Services data on forcible rapes that were committed in each county, and there are 6 regions throughout New York State that were offered an opportunity to apply. We are Region 4, and it was predetermined that it would be Albany County, Schenectady County, and Oneida County. So that's how the 3 counties were determined, and we had previous relationships with both Planned Parenthood Mohawk Hudson and Oneida, the Y Mohawk Valley. So that's how that came about. So this is a 3-year renewal with the Department of Health between them and Albany County, and then from Albany County contracting with both Planned Parenthood and the Y. So this is going to allow us to do 3 more years of the community education work that we're doing. For example, this is the Safe Bars Healthy Nightlife Initiative. So we're really looking to change the culture in our county and our society, really looking at holding offenders accountable and really changing the fact that the rape culture that is so pervasive and allows sexual assaults to be committed even to today.
Great, sounds like a good use of these funds. Are there any members of the committee who have any questions? Mr. Bergdorf.
Just curious, how do you, Karen, how does it break down between the Y and Planned Parenthood?
It's close. It's pretty closely divided. Planned Parenthood has to have a staff person that is 100% committed, so they have, I think, maybe a few $1,000s more, but between the Y, then we have the second most, and then the Y gets the least. We're lead agency, so I actually have great control over the budget, and I've determined, really looking at, we have a lot of grant money, so Planned Parenthood got the most because they have one staff person who's 100% committed. We have a few staff people on the budget. They're doing different things, and then the Y gets the slightly less than we do, but it's determined by me.
Okay.
Great. Any other questions? Is there a motion? Motion by Ms. Cunningham, second by Mr. Mayo. All in favor?
Aye.
Opposed? All right, the motion carries.
Thank you so much. Thank you.
Ms. Ziegler. Okay. Item number 18, this is public hearing, proposed local law S. This is Mr. Clanahan's local law. He's not here, so, pending getting some information from him, I'd like to table it. So if I can get a motion to table it. Table it. All right, all in favor?
Aye.
Okay. 19 we did. 20 local law F, the anti-nepotism policy. My understanding is we're tabling this as well, correct? All right, can I get a motion to table this? Oh, all right, just table it. Item number 21, this is local law T. This is term limits. This is tabling as well, so we're tabling this. All right, so now we'll go to the previous business. My understanding, we'll table number 1. This is the paid sick time, the public hearing is tomorrow night. Local law number 2, local law number G. We're going to table this. Item number 3, local law H. We're going to table that. The public hearings are tomorrow, correct, for 2 and 3. Item number 4 is Mr. Fines. Bulk storage tank bill, he's not here, so we'll table that. Item number 5, amending the Albany County Rules of Order, we're going to table that. Item number 6, resolution number 238, amending the legislative procedures. We're gonna table that. Item number 7, this is mine, we're gonna table that. Item number 8, local law number N. This is the Economic Development Director. We're gonna table that. Item number 9, resolution number 281, amending the legislative rules of order. Bill, that's Bill's, we're gonna table that. Item number 10, local law number O. This is the reapportionment redistricting local law. The public hearing is tomorrow night on that. So we'll table that right now. Item number 11, resolution number 333. We're gonna table that at the request of the chair. Number 12, resolution number 339. This is amending the legislative rules of order regarding the chairpersons. We're gonna table that. Oh, Mr. Clinton, you're here. You can go back to your thing in a minute. Item number 13, this is resolution number 340. Ratio of committee members, change to the rules. We're gonna table that. Item number 14, resolution number 341. Table that. 15, local law R. This is Mr. Fines, he's not here, we'll table that. Item number 16, resolution 376, this is a public hearing, local law R.
Mr. Fines.
Table that. Item number 17, local law S. This is your local law, Mr. Clenahan. Under current business, item number 18 is the public hearing. We tabled that, but you're here, so do you want to table the local law, number 17? Okay.
I thought it was good. I would like to certainly table the local law. I would
Okay,
like
so
to
we'll
go
table
forward with the public
17.
hearing if possible.
All right, going back to 18. Oh, okay. Can we get a motion to reconsider 18 for Mr. Feeney, seconded by Ms. Cunningham, all in favor?
Aye.
So we'll go back to 18. You're here, thanks for your attendance. You want to talk briefly on this?
Yes, I think the point of this local law is that there have been an increasing number of cases across the country where hospitals and other medical facilities are denying certain types of treatment and certain types of methods, often based on religious exemptions or religious objections, which I'm not getting into that issue, but it seems to me this is a bit of a growing concern because the Trump administration has recently proposed and is close to finalizing regulations which will increase medical individuals and medical facilities' ability to deny treatment of certain services based on religious exemptions. Again, don't want to get into that debate, but I think at a minimum, if a facility is going to deny certain treatments that are expected, they should post it on their webpage so that people know. Particularly so that people aren't in a situation where they're going to a healthcare facility expecting to have a certain kind of, frankly, emergent treatment and get there and can't have it. So I think this is just a matter of disclosing so the public knows what's available and what isn't.
Can I ask you a question?
Yes.
So any reason why you limited it to hospitals and not other kinds of healthcare providers?
I think I was mainly thinking of emergent patients. So, you know, if for a regular doctor's office, if a patient gets there and the service can't be provided, it's certainly
No, but
not
like.
great and it's an inconvenience, but in an emergency situation, if you show up at the hospital and you can't get a treatment, you could be in real grave trouble. So I think
Right,
that's
but
why I
I'm
did
thinking
that.
of the woman who recently tried to fill a prescription at a pharmacy and was denied the pharmaceutical that she was recommended by her physician to complete essentially a miscarriage that she was sort of in the beginning of. So there wouldn't be any contemplation that you would want to require pharmacies to also similarly post.
I certainly wouldn't have an issue with that, and I would defer to counsel, but my understanding is that pharmacies are regulated and licensed by the federal government, so we might not have the ability to do that with pharmacies. I believe pharmacies are regulated by the federal government, but pharmacists individually by the state. So I would be unsure of our ability to do this on a federal level.
So there's a recent Supreme Court case from 6 months ago that found law requiring posting of this type of service unconstitutional. So there's some caution that should be taken with this law. We're talking about 6 months ago, the Supreme Court just came out with a case that addressed this type of law. And there's tweaks that can be made to this type of law, but I think Mr. Clenahan should consider taking a look at that Supreme Court case before moving forward to a public hearing, as there are possible exemptions you might want to enter into this law.
I'd be curious to hear more about the case,
Sure.
particularly because there is an existing Washington state law which has gone unchallenged and is accepted.
Sure, and I'll have to get back to you with the exact language of the case, but the case involved a city which required all health facilities to post in their lobbies requirements of what Planned Parenthood services and other services related to maternal health care there are. That was found to be a violation of the First Amendment with regards to religiously affiliated organizations, clinics, and the like. Those clinics won a First Amendment challenge to that type of law. So I think some caution should be taken with regard to this type of law. Again, there's simple tweaks that could be made to make the law clear. That's something that should be discussed.
Well, that being said, Mr. Clenihan, did you want to table the public hearing, or do you still want to move it out?
I would like to move out the public hearing.
Could
And the
could we
reason I
continue
would
to have
say is that
discussion?
Yeah, sure.
the text of our law is based almost entirely on what Washington State did, which, as far as I know, has gone unchallenged and is accepted law. I would love to hear the particulars of the other case, but I think two other exceptions, I think, may get us outside that case. It sounds like the Supreme Court case involves a much wider swath of healthcare providers. Our ability to legislate in terms of public health and safety, and particularly in terms of emergency situations, this is what this would largely apply to here, I think is a little wider than just in any general medical facility situation. And I think another concern is that it seems like every day we find one of the major hospital groups acquiring another bunch of doctor's offices or another smaller hospital or another bunch of clinics. The centralization of the healthcare industry is growing every day, and that means that more and more facilities are coming under some of these laws and some of these rules and some of these more restricted offerings of services. So this is a situation that's going to keep becoming more prominent.
Mr. Bergdorf, did you have a question?
Well, I have a question and also, I guess, a comment. If there are federal preemption issues in New York State, hospitals are regulated by the New York State Department of Health, aren't there potentially New York State Department of Health preemption issues? And it seems to me that there are, and I'm not so sure. I mean, we're going down a road where we're going to be trying to tell people how to run a hospital, how to run a medical practice. And I'm not sure that we're really qualified to do that. We have a public health council that advises this county of a bunch of doctors, which we have asked to advise us on public health matters. I'd like to have someone in a medical capacity decide what a hospital should do, what a practice should do, et cetera. I'd like to have that input before we put something out for public hearing, because we might find ourselves where we do have a defect with language or a preemption issue, or maybe there is a legitimate reason to go beyond just a hospital proper, if there was a recommendation to do that in such a legal way. Certainly not advocating that somebody go someplace for medical services and then be denied and have it be a surprise. That's certainly not appropriate. But I think if we're going to do this, we ought to do it right.
I'll let the sponsor.
Well, I'm happy to get input on this and hear from folks. If you think there are issues we should look at, I certainly have no problem with that. I would disagree with you a little bit on both your points. Respectfully, as always, Mr. Bergdorf.
Yeah, absolutely.
Preemption, I think, is a very specific issue, and the state, to preempt smaller governments, has to be very clear that they are preempting that field and are occupying that field conclusively. I don't know that the state has done that in terms of, certainly not in terms of healthcare, but I'm not even sure in terms of hospital oversight. So I think that's a less clear case of preemption. And I think also the goal of this, and I don't think what would happen if this were to be passed at all, is not at all to tell hospitals how to do their business or affect what they do in any way, shape, or form, or direct them or anything. I agree with you. We don't have the qualifications to do that. All I'm saying with this legislation is, if you're not going to provide a service, disclose it up front. Whether they want to or not provide that service, that's entirely up to them. But give the consumers the knowledge up front before they are heading to a facility in an emergent situation.
It's my understanding that they have to do it already on charity care,
On what?
on their charity care policy.
I can tell you that the only language, the only law in the books anywhere in the United States, based on New York Times article from several months ago, is
No, I
Washington
know,
State.
but I think it's a DOH reg that they have to post their charity care.
I tell you, I've been through the major websites, particularly the St. Peter's Prime Care Group, and I don't see any disclosures there. And I
Okay.
know they're a Catholic facility, which does not do certain procedures.
What about end-of-life care? I mean, that goes beyond just the hospitals. There are all sorts of hospices and stuff like that. Would they come under this, or only if they were affiliated with a hospital?
Only if they're affiliated with the hospital. I don't see how an emergent type of situation would come up exactly with the end of life care.
I mean, it's
But again,
pretty-
that's a question if we want to look at further. I'm definitely interested in hearing more of your thoughts about it.
I mean, this is targeting acute care hospitals, so those, I mean, that's a limited bucket, there's 220 of them. Whatever the number, but it's a limited bucket, so.
Ms. Willingham, did you have a
Yes,
comment?
I just, if I may.
Sure.
How does this change the posting that is in the hospitals? And you did, we're speaking to emergency rooms, where it does put, there's something in there that lets people know that they have a right to this kind of care, that kind of care, and so forth. So how does this change that? And is that a county posting, or is that a state posting? Or what's the, where did that come from? Because that is in all, I think I've been in all the hospitals with one of my kids or another, But there is a posting in the hospital which speaks to the type of care that people can be entitled to, whether they have insurance or not, and, and so forth and so on. So how is that affected by this?
I'm not sure it would affect it at all, and I certainly don't think it would cut into that, because that's a very important goal. I think all this would do is be very upfront with consumers that they don't provide certain services if they choose not to. But in terms of their patient rights under federal and state regs, I don't see how that would affect it at all.
Well, I guess, Mr. Clay, it's your bill, so I'm going to take the lead from you on what you want to do with it. That being said, I would note, even if it comes out, it still has to be voted on by the whole body. And we will have we'll have another committee meeting before the public hearing, just like we're having a committee meeting tonight, the public hearing's tomorrow. So a lot of these questions, I don't know if if we move it out, if you can get this case, take a look at the case, see how it compares to this law, maybe some of these questions the members have raised, they can certainly be addressed,
Well,
next month too. It's up to you, it's your
Well,
local
the local
law.
law's been here, I think, 2 months now, but the public
Sure.
hearing resolution is only 1 month. I'm happy to hold this another month to address some of these questions, and
It's up to you.
and I'm fine if folks want to reach out to the health board for their input and thoughts. I certainly don't have an issue with that. I just am always very cautious about a group that is basically made up of the other branch of government having an ability to essentially veto legislative actions. So I would not agree that the the health board has a veto over legislation, but if they feel appropriate to give their input, I certainly see no harm in that.
So do you want to wait on it, or do you
Yes.
want to move it out?
We'll table the public hearing.
You sure?
Yes.
All right, so we'll table this, I guess, for now. Make a note, if there's members who have concerns about it, reach out. Do you want to make a formal request to the Department of Law to weigh in on it?
No.
No?
No, I feel our counsel's office is more than competent. In fact, it sounds like our counsel's office has already looked into this.
You guys want to put something together for the committee?
I'm happy to provide the case to Mr. Clenahan and to anyone who wants to take a read of it.
You want to
Could
send
I-
it around to everybody?
Yeah, send it to
Could I,
everybody.
could I ask that
Sure.
council's office or, jointly,
Sure.
also send a letter to our public health council asking for their input on this?
Who's the
It'd be-
Public Health Council?
Well, we appoint people, we have Public Health Advisory Board, yeah. No, there's
Lucy
a,
is our rep on the health.
yeah, but there are also, I think, three MDs and folks who, have advised on other health matters in the past.
Are you talking about the Board of Health, Mr. Bergdorf?
Is it the board, is that
Yeah.
the former name? Yeah.
So in response to that, Paul, I'm going to defer to the chair's office. Typically, these type of requests come out of the chair's office, so if they're willing to do that, that certainly, without telling them it'll come from them, it can come from the chair's office.
I amend my request. Thank you.
Okay, well, I guess, that being said, we'll table that at the request of the sponsor. There's no further business before the members, before the committee. That being said, we are going to have a joint audit, finance, and law committee meeting to review the portions of the budget that the committee has jurisdiction over. So that's going to commence at 6:30. I've also invited the two commissioners from the County Board of Elections to attend that to discuss the recent potential move that the executive has floated to move their offices. I sent them a letter. I have not heard from them, so I don't know if they're going to attend or not. I guess we'll see. But that's going to be at 6:30, and obviously the members of Audit and Finance will be here, and members that want to stay for the law committee. 6:30. We'll commence that at 6:30. So that being said, I'll take a motion to adjourn the committee meeting. Mr. Cunningham, second by Ms. Cunningham, all in favor?
Aye.